guys, welcome back. I'm in need of chapstick right now, but I think they're both downstairs. But it is me, Grace, and I wanted to kind of do a more formal video because I feel like my first video is pretty like just me talking and then like vlogging and also like the editing. I'm gonna be completely honest, that video is a total mess for editing. Because I just cut out so many random things that didn't need to be in there, and it's like a 22-minute video. So honestly, if you didn't watch that video, I'm not mad. What I'm gonna treat this video as is kind of like diagnosis, kind of more talking about the medical side so that people can have a clue of that. I know in my vlog that I just uploaded, I said that I was gonna maybe wait until I was undergoing chemo, but right now I'm just feeling good and I don't know how long that's gonna last. Right now it's very up and down. And so I figured why not just do it now. Also, my hair is really cute. I curled it today. And I'm wearing like kind of a cuter outfit because I went out with a friend today, and so I'm like, you know what, I'm just gonna do it now. So we're just gonna move right into it. I did sit down this morning. I filmed a 50-minute video talking about my diagnosis, talking about all my history. And then I was like, you know what? I don't think they need to know all of that. And I also think that if this YouTube channel, not if it like picks up, but if I continue uploading, like there's just going to be more and more stuff, and you guys are just going to find out more about me anyway through that process, that I don't feel the need to like 100% give you everything right now, because there is a lot. I have a very long medical history, and I'll give you a brief synopsis of it, but right now I think the most important thing, and the thing that most of you are probably wondering about and wanting to hear about, is my diagnosis, what's going on with me, and kind of how I figured out I had it, and like that kind of story. So I'm gonna try to be as concise as possible, because I don't want to have people sit through a 50-minute video, because that's literally what it was. And the thing is, I don't think I could really have edited much of it out anyway, because it was all important stuff. But I think the main things I want to focus on today are giving you a little bit of background knowledge on me, talking about what happened and how I got my cancer diagnosis, and then talking about moving forward. So for a little bit of background knowledge, like I said in my previous video, my name is Grace. I'm 20 years old, and I have had a lot of medical stuff. I'm not going to go over my entire body because most of it doesn't relate. A lot of it is just immune system. I have a weak immune system, and I have a lot of like diseases or conditions that have come off of that. The biggest one, and the one that is probably most relevant to the cancer because it will be affected by it, is I have type 1 diabetes. I was diagnosed when I was 7, so 13 years ago. It's not a new diagnosis. I have a diabetes insulin pump. So that's kind of like the main thing. And so then now moving forward into stuff that relates kind of to the cancer is leg issues. So I have other issues. I have like eye issues, thyroid, something in my lungs, my stomach. I'm not really going to go into those right now because I feel like they're not currently relevant. And also, if I do go into that, that is why this video will be 50 minutes. So I'm not trying to make you watch a movie right now. You know, just trying to give you a little information. But basically, I was a freshman in high school, and my sister like bumped my leg one day, and I was in severe pain. We went to the doctor. He found a non-ossifying fibroma, which maybe I'll put a definition, maybe not. It's basically just a little like benign tumor that was in my bone. So we were seeing an orthopedic, and we went in for a checkup about a year later, and just to make sure that nothing had happened, obviously, to be proactive. And the year later, so I was a sophomore, I was like around 15, he was like, okay, there's something seriously wrong, and I'm not equipped to deal with it. He said, you need to go to the University of Chicago. He thought it was osteosarcoma, and it was basically just a mass in this area of my leg that was not supposed to be there. And they found it on accident through an MRI, just checking up on the fibroma. So he sent me to University of Chicago, and I saw a really great orthopedic surgeon, and he did 2 biopsies because the first one came back inconclusive, and they wanted to obviously make sure it wasn't osteosarcoma, and they ran a bunch of tests and stuff, and it came back that it didn't have osteosarcoma. What I was diagnosed with was osteomyelitis, which is an infection, and he told me that mine wasn't infectious, or at least that it wasn't spreading. So we saw him for several years after that, going back like every 6 months for a little while, and then we started going every year. And I would complain about swelling and about pain, and he would kind of just say that's a part of osteomyelitis, and it's not growing, and we're not concerned about it, so we're not gonna like go in and mess with your bone. And like the inflammation, the swelling, it was a part of it. So everything seemed normal on that front. Then about a year and a half ago, this was 2018 summer, it started hurting a lot, and it would swell and it would hurt. And we went and we saw him, and he basically said, I think that he's like, I think you should see a different doctor, or go back to your old orthopedic, because I was having pain in my leg here, but I was also having severe ankle pain. And so he said, I want you to see them about the ankle pain. So we went back to my orthopedic, and he kind of tried to help me. He like set me up with a foot and ankle specialist. He set me up with a rheumatologist. We were kind of just trying to figure out the pain. And then I ended up breaking my leg last summer. I will put a photo here because it's hilarious. Basically I broke my leg. So then we kind of put things on pause. So this was 2019 summer. So now I had this ankle pain, I had this pain in my leg, but basically now the focus is obviously to deal with the broken leg. So we did that, and then in November, I was healed. I wore the boot, crutches, stuff for the broken leg, and I ended up going to get an MRI on my ankle, and they didn't really find anything. And so we just kind of we're like, okay, we're going to try to set you up with a rheumatologist, because there's the chance that you have like something going on there that we can't really see on the scans. And so November is around the last time I remember feeling normal. So obviously I'd been having leg pain. I'd been bothered by my leg for years. And I went back to school, and I was walking back from class. This was like very beginning of December. And I was walking back from class, and something just happened to my muscle, my right calf muscle. Something happened. And then that entire night, I didn't sleep one wink. My ankle hurt, my muscle hurt, my leg hurt. I was crying. I was trying to ice it. I was trying to use heat. I tried to take melatonin. I tried to take pain medication. Like nothing was working. I was inconsolable. I didn't get any sleep that night. And so the next morning, I went to my health center, and I told them, like, I don't know what's going on with my muscle. I also was like, I think I might have done something to my break, because my ankle was hurting. And they were like, I think you just strained your muscle. And they gave me a wrap, and they're like, we're just going to compress it and just try to like stay off it and be light on your feet. And so that was the first sign kind of something's going wrong. And then over the next 2 weeks, I stopped being able to really eat. And I noticed I was getting fevers, and I couldn't really eat. I had back pain. I had my leg pain, obviously. And I was really fatigued. And I just felt bad. And this was also final season. So not on top of that, I was extremely stressed out and under extreme duress. And so it was just a mess. And so finals week, the way it worked is we had classes up until Wednesday, and then we had reading day on Thursday, and then finals started that Friday, and then they went that entire next week. So how my schedule worked is I only had 2 finals that I actually had to go into. The rest were like projects or like submissions. And so I had a final on Friday, and then I didn't have a final until Wednesday. So I remember Saturday morning, after that previous final, I woke up and I was like, I feel so sick. I can't eat. My back is hurting, my back is killing me, my leg's killing me. I was like, I'm going into McKinley. So I went into the health center, and they tested me for a few things. They thought maybe something was going on with my kidneys because it came back inconclusive that I possibly had one and that there was possibly like an infection. Later they did like culture it, and it turned out I didn't have a UTI, and it was actually just symptoms of my cancer. But at that point, that's kind of what they were treating me as. So I went home that Saturday and I just rested, and my mom took care of me. Then I went back for my final, moved out for winter break. And then over winter break is when the swelling started happening. So I don't know if I'm gonna put like a slideshow of pictures. I took a lot of pictures. But basically, we went and we saw my orthopedic doctor. Actually, no, it wasn't the orthopedic, it was the foot and ankle specialist. We went and saw her, and she gave me a cortisone shot because she said, if your ankle pain is from inflammation, a cortisone shot will help and it will make you feel better. It didn't, obviously, because I think the ankle pain might be a part of everything that's going on, just because that would make sense. But basically, we tried that, and she referred me to physical therapy because she said that my muscles were very tense in this calf and that I didn't have the full flexibility still because I had been in physical therapy after breaking my leg, obviously. And she just wanted me to get a little bit more physical therapy to help make sure the muscle was working properly and I had full motion, which obviously the muscle being tight ended up kind of connecting to everything. So it's crazy how it works. But basically, after that, I went to physical therapy, and I went back to a physical therapist I'd already been to for previous leg stuff. I have like a knee issue that it doesn't relate to this, but I had to have physical therapy from that. My physical therapist was very concerned with the swelling. He said it kind of looks like lymphedema. He said it could be a chronic pain disorder. He was really trying to like look into options and stuff, and he said because there's just something not right about the swelling that was going on in your leg. And I remember my friend was staying with me too from Scotland, and that's when I really noticed the swelling. I like remember I was in the bathroom and I was taking pictures, and I'm like, this looks like there's like a golf ball in my leg. And it's never happened before. Yes, I've had the swelling from the inflammation from the osteomyelitis diagnosis, but I've never had it like this. So to me, it was wrong. And then it kind of went down. And then I went back to school, and it kind of was coming in and out. I was noticing it for like the first week of school. And then I remember it was like Tuesday or Wednesday of like the first week of school, and it started swelling, and then progressively over the next week it was getting bigger, and it was getting to the point where like my pants were tight, like you could see like the bulge on my pants weren't really fully fitting me. Like I couldn't even wear a certain pair of jeans that I own because they're like, it was so tight on them. And so I told my mom, obviously, and this was Friday, January 31st. The dates might be a little mixed up, but it was a Friday, end of January. And I remember I didn't have class on Fridays, and I walked out of a meeting that I was in, and I said, Mom, this isn't right. I want to go to McKinley. So I did like the dial-a-nurse because it gets you in quicker, and then they can also tell you like, do you actually need to be seen? Which I knew I needed to be seen, but I did it anyway. And she's like, I don't want you driving. You need to come in right away. I went in. Literally, the doctor at my health center walked in and said, you need to go to the emergency room. We think you might have a blood clot. So I was sent to the local hospital, and I was all alone, and I spent 7 hours there. I was all alone. It was super fun. And basically what they did there is they did blood work, and it came back inconclusive for blood clots. And then they did an x-ray, And then they found like 2 masses that they didn't even tell me about at that visit. I didn't even learn until a week later that they had found 2 masses. And they did a venous duplex, which is basically, I always forget what it's called. But when you're pregnant, you know, the sonogram or whatever, they did it on my leg and basically didn't find any blood clots. And they referred me to an orthopedic to deal because they thought that they saw 2 tumors and they thought it was part of my osteomyelitis. They also told me osteomyelitis is rare. It's not a common thing. They said it was the first time they'd ever seen it in this place. And they basically just sent me home. So then I went on for a week, and then I was on the bus riding home Thursday of the next week. And I had told my friends, oh yeah, I went to the hospital over the weekend, and you know, it's because of this weird swelling that I'm having. And I had shown them on like Monday, and I'd seen them on Wednesday too. And then on Thursday, they were like, that looks worse. And, you know, for me, like seeing it constantly, like I never really knew, you know, how good or bad it was because it would fluctuate, the swelling and the sensations and the pain and the bothersome, it would fluctuate. So I never really fully knew. And I think it was like, I was talking to like 3 different girls, and one of them was even like, I will drive you to the emergency room tonight if you need to go. Like, that does not look good. So basically, that's what set me off. And obviously I'd been advocating for myself and I'd been saying this isn't right, but when other people like my age who had seen it before were like, no girl, that like does not look good, even though they're not medical professionals and all, I was like, okay. So I called my mom crying, and my mom called the ER and was like, hey, so she was in last week, doesn't have blood clots, but this is getting worse. And they said, okay, she needs to come into the ER tomorrow. They didn't say it was like an emergency, but they said come into the ER tomorrow and have your mom come so that you can have someone there to like kind of advocate for you, and you know, just make sure that things get done. So my mom came up, we went to the emergency room, I saw a doctor, got an MRI, one of the worst experiences of my life. I had a panic attack in the MRI, and it was absolutely horrible. But basically the doctor came back and said they found something on the MRI. It looks like 2 tumors, or just when they say tumors, they just mean masses, and they're concerned it could be cancer. They're concerned it could be osteomyelitis, like really acting up, or it could be another type of infection. Basically, they said you need to go back to your doctor in Chicago, because they said they could treat me there, but they're like, it's better to go like where you're established. So my mom called my doctor and told him, because I hadn't seen him in like a year and a half, because he had kind of like released me to a different doctor because he said things were fine, and called him, and then also did some research and found another orthopedic surgeon in Chicago that's very well rated at Northwestern. And she basically said, we're just going to try to get whichever appointment we can get first. It wasn't like we were like angry at the doctor. It was more so we just wanted to get in to get an appointment. And so we actually got in with a different doctor, a new one, and then we called the old doctor and told him about it, and he's like, oh, he's an old colleague of mine, go for it, I trust him like to take care of this. And they were kind of communicating, and so everything was fine. Went and saw this new doctor. They got us in within like a couple days. So I left school, went home, and this doctor basically said, based on all your symptoms, like with the muscle, the bone, looking at the MRI, it looks like you have an infection in both your bone and your muscle. And he said, I need to do surgery right away. It's going to be a large incision on your leg. And he said, I'll put the specific surgery name maybe here. It's basically like, they call it like irrigation or something when they go and they clean it out. And he said, there's a chance that I'm gonna have to drill into your bone and you won't be able to walk from like 6 weeks to like 3 months. And he said, we need to do this like ASAP. So I went to like pre-op, whatever. And he also said, we are gonna do biopsies, and if anything looks wrong, we're gonna not do the surgery, like not do the cleaning out, and we're gonna just send things in, because he said there is obviously the chance that this could be something else. So then, basically, sorry, I'm really thirsty because I've been talking so much, so a little bit of water. I go in for my surgery, and I don't know, I think apparently my doctor came when I was in recovery, and I was so high on like the drugs, the pain medications, and still the anesthesia that I don't even remember him coming. But I know that when I got back to my hospital room, when they actually brought me back to where my parents were and my sister and my aunt, everyone was there, I knew that I didn't have the surgery I was supposed to. I knew that something had gone wrong. That was like the first thing I asked my mom, and I was like, what happened? And basically what he told me is he went in and it didn't look like the infection he thought he was going to find, and that he didn't say it was 100% cancer, but he said, I don't know if it's something with like tuberculosis or a different type of infection, but he basically was saying it's not osteomyelitis. And he said he was concerned it was cancer, especially looking at the symptoms I'd been having, like the not being able to eat, the fatigue. I'd been having fevers. I'd been having night sweats. At that point, I wasn't really having night sweats as much. That's been a more recent thing. But looking just overall at the symptoms of cancers, it seemed basically like I probably had cancer. So I was supposed to stay in the hospital after the surgery, the previous surgery that we thought I was going to have, to get treated for the infection by like an infectious disease doctor, and I was probably going to stay for a couple days and be admitted. Well, obviously I ended up not having that surgery, so I only stayed one night, and they discharged me the next day, and they let me go home. And then they basically said, yeah, we're going to send all of the tests that we took, because they took a bunch of tests, and we are going to hear back from pathology. They take a little while. And he said it could be anywhere from like a week to even longer. And so I went home, just tried to recover from the surgery. And I was sleeping a lot, especially in the beginning. And then we got a call literally a week after my surgery from my doctor, who had performed the surgery. And he said, do you guys have time to talk? And that's kind of when we knew. He basically said, I have lymphoma. He didn't know everything, and obviously it's not his specialty whatsoever to cover oncology. So he said, I'm referring you to an oncologist here in the hospital, a very good lymphoma oncologist, and we're gonna get you set up with an appointment with them. But he basically said, you have lymphoma in your bone. I don't want you walking on your leg still. And we had an appointment to get my sutures out and to see him. So then the next week, we set up a bunch of appointments to see both my old doctor to get my sutures out and just kind of check over everything with the surgery. And then I was getting a PET scan to scan my entire body to see if there was cancerous cells anywhere else. And then I was going to see my oncologist and start obviously like learning more and setting up treatments and kind of moving forward. But unfortunately, I had one of the worst weeks of my life in between that week. I went to the ER and got a blood clot in my muscle, which my doctors aren't very concerned about. They said with the cancer and with not being walking on my leg after the surgery, that it's very common. And they said if I didn't have cancer, they wouldn't even treat me for it. But just because I do, they just want to, give me they gave me like something to help thin the blood, and that was given to me in the ER. And then I ended up throwing up the entire night, and I was complaining about this pain right here that was causing me to feel sick and not be able to sleep and vomit. And so we went in on Thursday, and I had thrown up the entire night. I was absolutely miserable. It felt like my body was shutting down. And I went in, and I saw my doctor, got my sutures out. He said my site looks fine, just to stay off my leg until after I've gotten a few chemo treatments, just to make sure that since it is lymphoma and it's around my bone, the bone is obviously very sensitive, and he's like, we really just don't want to have to deal with like a broken leg right now. Like that would just be the worst. We don't want to add anything on. So then I went and got my PET scan, which was difficult with diabetes, but I'm not really going to get into that because I was able to get it, but you just had to have a good blood sugar to take it, and so I had to sit there for like 2 hours waiting for my number to come down. And that obviously made me feel even more sick because you can't eat before it, and I hadn't eaten in like 2 days, and I had nothing in my stomach, so I was just feeling awful. And then I went to my oncologist appointment, and he said that he showed me the PET scan, and he said that what I have, which I did put the diagnosis in my previous vlog, but I'm just gonna like kind of clarify. So basically there's Hodgkin's lymphoma and there's non-Hodgkin's lymphoma. We're not even gonna talk about Hodgkin's because I don't know anything about it and I don't have it, so I don't need to worry about that right now. But what I have is non-Hodgkin's lymphoma. In non-Hodgkin's lymphoma, there are like fewer than 200,000 cases a year, so it's not a super common cancer. But there are B cell and T cell. And it's just the type of cells. And what I have is I have B cell cancer. And so we're not going to even worry about T cell. So within B cell, there is aggressive and there's indolent. So indolent is where they treat it as like a disease, where if you are having symptoms, they'll treat you, but they don't, the goal is not really curing it. It's more of a, from what I understand, a more mild form of the cancer. And aggressive is where the goal is to cure. So I have the aggressive cancer. I also have a mutation. And we also haven't completely heard everything back. So I could even have more things going on. But basically what my doctor told me is I have a mutation, and I have cancerous cells in my chest, which is why I was most likely why I was having the pain. I also have a few like near my groin, and I have it in my right upper leg. And so that is why I have diffuse large B cell lymphoma. And that is my diagnosis as of the moment. And I don't know what the mutation is. It's something with an M. I'm sorry, but that basically means that I need a little bit more of an aggressive form of chemo. So now, that was my diagnosis. So moving forward, my doctor said that I need to do this type of chemo called EPOC. What EPOC looks like is it's 6 treatments, and it is 4 to 5 days inpatient. I could do outpatient, but he wants me to do inpatient at Northwestern. 4 to 5 days in the hospital getting chemo, and then 3 weeks in between, and 6 treatments. So it's gonna be around like 4 to 5 months of treatment. And he is very hopeful and very positive thinking, which is obviously all you can really do in this situation, that this is going to be able to cure it, that I'm going to start feeling better. Obviously, there's going to be the chemo symptoms, but he thinks that the other symptoms that I've been having are going to go down, especially this. And he's not concerned about this. I also want to clarify that what's in my chest is not an organ. It's just swelling of lymph nodes, because lymphoma is a blood cancer, and it's also a like system. So it's just something up here in the system. He's not concerned about it. He said he's actually like, it's very common for, if you have it in one area, you're probably gonna have it in other areas as well. So the hope is to be cured by summer. Obviously, there's always the chance it could come back or that I could need more chemo. But moving forward, we called my school. I'm leaving school this semester. And the plan is obviously to take another year. There's no way I can't with the professional development. And since I'm a junior, I'm in very structured, specific things, and I have to do it in a certain order. But the plan is that I will be back in school in the fall. So that's the plan moving forward. Right now, we are waiting. Right now, I think I'm in a more positive mindset. But basically, tomorrow I'm going in to get an echocardiogram. I'm going in to get a CT scan of just my chest so that they have stuff to compare. And I am meeting with fertility because they advised that although I am young, and they're especially saying the fact that I am only 20 years old is very good for both the chemo, the type of cancer, and for fertility in general. But I'm going to probably end up freezing eggs just in case it did come back or something did happen with the chemo. Because there is always the chance I could go infertile, and if I eventually want my own children biologically, that is definitely something to consider. And in a way, I am kind of grateful because my doctor said, yes, this is urgent. We need to get you in chemo soon. But he also said it's not emergent where it has to happen now. And he said we can take the time to talk to fertility and go through those things before. And in a way, I'm very grateful for that because that way I get to kind of, you know, play around with the short hair. I'm going to do a photo shoot, like I said. I'm going to try to see as many people as I can before I go into chemo, just because I don't know what it's going to happen then. And we're also going to potentially go and like move my stuff out of my apartment and kind of do that. So we're taking this time kind of as a blessing in disguise. As long as I'm feeling good, we are just taking this time to prepare. I've been doing a lot of shopping. I've been doing a lot of reading up on this, and I'm just kind of trying to prepare myself mentally for what I'm gonna go through, and also prepare myself like in general. So that is the plan moving forward, and I am just gonna say one thing. I said this in my 50-minute video, and now we're at 35 minutes, so I'm gonna try to be short. But what I wanna say is, if you are feeling pain, if you are concerned about your body, fight. Keep going, because nobody can feel what you're feeling, and find a doctor who's going to listen to you. One of the best moments is when I went to see my first doctor at Northwestern, and he said, your leg is speaking to me. It's saying that something's wrong. And he said, and I think it's speaking to you. And I know that may sound like weird spiritual, but my leg was speaking to me. I knew there was something wrong. And I am so incredibly grateful that I didn't give up on it, because who knows what would have happened. So I just wanted to give that advice to you guys, especially if you're watching. Even if you don't have cancer or anything, speak up for yourself, fight, advocate, and find someone who's going to listen. You can get the care that you need. And that is one of the best things, is that my mom listened to me, I listened to myself, and then luckily I was able to find doctors that were able to listen and are going to be amazing and take care of me. And I'm really hoping I can get back to school in the fall. I'm really hoping that this is all I have to deal with, but I'm just going to take it as it comes. And I'm really excited that whoever you are out there, you are coming on this journey with me, and I am so incredibly grateful. So here I am signing off, sending all my love, and thank you so much for watching.